the Navy Office of the Navy Chief of Information. On the phone from San Diego, we have Rear Admiral Timothy Weber. He's the commander of Navy Medical Forces Pacific, and Captain John Rochuk, the commanding officer of the medical treatment facility on the USNS Mercy. The gentlemen, the floor is yours for opening comments.
Good morning, everyone. As mentioned, I am Rear Admiral Tim Weber. I'm the commander of Naval Medical Forces Pacific, responsible for Navy medicine assets, including personnel in military treatment facilities on the West Coast and the Pacific Rim. People are Navy medicine's greatest strength. We stand ready to support the nation today as directed by our civilian leadership because of the hard work and dedication of the Navy medicine team. In a matter of days, we have assembled an incredible crew of more than 800 medical professionals who will embark on the Mercy to lift the burden off local hospitals so they can focus on caring for patients with COVID-19. The USNS Mercy and its MTF staff, or military treatment facility staff, and civilian mariners are ready for their mission in support of local health authorities and the communities overwhelmed by this pandemic. Even though this is not our traditional mission, which is typically focused on combat casualty care, our doctors, nurses, corpsmen, pharmacists, laboratory professionals, and many others are agile, responsive, and ready to serve the needs of our nation. We are honored to answer the call in this time of need. We are committed to protecting the health of our force and the health of our nation. We are, as the USNS Mercy's motto says, steaming to assist. Now I'd like to introduce Captain John Rochuk, the commanding officer of the Mercy's military treatment facility. John, over to you.
Thank you, sir, and good morning, everyone. Today is a big day for the Mercy, Navy medicine, and our national response to the coronavirus pandemic. We are about to embark Mercy to increase medical capacity and collaboration for medical assistance and disaster relief in Los Angeles, an area of our country that has seen some of the greatest impact from the coronavirus pandemic. We will be ready on arrival to support FEMA, state, and local agencies' efforts to protect the health of the American people in this whole-of-government approach directed by the President of the United States. This global crisis demands a whole-of-government response, and we are ready to support. Mercy brings a team of medical professionals, medical equipment, and supplies, all of which will act, in essence, as a relief valve for local civilian hospitals in the Los Angeles area so that local health professionals can better focus on COVID-19 cases. We are not deploying to treat COVID-19 patients and are taking proactive measures to ensure anyone coming aboard is properly screened for COVID-19 and to mitigate the risk of a case on board. Mercy operates as an afloat hospital and has infection control procedures that will be followed just as any hospital ashore. We will use our agility and responsiveness as an afloat medical treatment facility to do what the country asks and bring relief where we are needed most. Our hospital ships are uniquely outfitted for humanitarian assistance and disaster relief, one of the Navy's core missions that these ships perform around the world. The men and women of the U.S. Navy and Mercy team are highly skilled, highly trained, and anxious to assist our communities in support of the COVID-19 response efforts. Here with Rear Admiral Weber and I is Captain Dan Cobian, Commodore of Destroyer Squadron 21 and the Mission Commander, and Captain John Olmsted, Mercy's Civil Service Master, and we're ready for any questions you may have at this time.
All right, for all questions, please provide your full name and agency prior to asking. We'll start with Idris from Reuters.
Sure. Thanks. Some basic questions, Captain. When will the Mercy reach LA, and will it be operational on that day? And could you tell us a bit about the personnel on board? How many reservists, how many civilians, and any active duty?
Sure, so thank you for that question. We expect to be there within the week, and we anticipate being able to begin taking patients the day after we arrive. We definitely have a sense of urgency, and we want to be there as quickly as we can to support FEMA's efforts with the local and state authorities. We have a number of reservists who are joining with our active duty team. That number is currently about 60, but may change as the mission evolves. All the rest of our folks are all active duty Navy with the exception of a small number of contractors who work for the ship full time.
This is Admiral Weber. I want to add on the reservists. As of yesterday, there were 58. These reservists are volunteers. And also, while they're medical professionals, they have self-identified as not being members of the clinical community helping their local jurisdiction with COVID-19. We're very acutely aware that many clinicians are helping with their local communities. So those 58 volunteers and not doing COVID-19 work presently are in their community.
How many active duty are there, and is there an end date for this mission, or is it indefinite?
So this is Captain Roadtruck. On the active duty side, we expect to top out at 11:28 working for the medical treatment facility, and I'll turn it over to the mission commander for the ND.
Captain Dan Coben, mission commander. So we are tasked, as you know, to treat non-COVID infected patients. We will stay there as long as it makes sense and or as directed by higher headquarters and in coordination with FEMA.
Okay, we'll take one question from the phone and then we'll come back into the room. So Laura from Politico.
Hi, no questions at this time.
Okay, Tom, NPR.
So Tom Bowman with NPR. This is for the captain. If you could just talk about what you know about the need in Los Angeles at this point. Are state officials, hospital officials reaching out to you? You know, the hospital's filling up and they need relief immediately. If you could give us a sense of that, and just, you know, presumably you pull into LA, you're at Pierside. Is that how this works? If you could just walk us through that as well.
So as you all know, FEMA is the lead agency, and they're responsible for our site picture of the needs and requirements of the local hospitals, so we'll take our direction from them. Our intention is to pull in Pierside and just transport patients by ground into the hospital ship.
But do you have any sense at this point, Captain, what is the need? Is anyone reaching out to you yet, or will you wait until you're Pierside?
So this is Captain Roadtruck again. They are not reaching out to me directly. FEMA is coordinating with our folks who are moving forward on the ground right now to help establish those relationships.
Okay, we'll go to Gina Harkins on the phone.
Hi, Gina Harkins from military.com. Wondering if you can explain the logistics of how someone might end up being treated on the Mercy. And will doctors and hospitals be referring specific cases there? And are there certain illnesses or injuries that the ship is most prepared to treat?
So as I mentioned, we're definitely taking non-COVID infected patients. Essentially, every patient transfer will be an inter-hospital transfer. So in other words, a patient that's already an inpatient in one of the local hospitals will be transferred to us. If they're an intensive care unit patient, they'll come to our intensive care unit. If they're on their hospital's ward, they'll come to our ward. We're prepared to offer a pretty broad range of critical care and other medical care for patients who may be on a ward. We have pretty broad surgical capability as well, so if a patient transfers to us and subsequently needs to have surgery, urgently or emergently, we're very capable of providing that.
Okay, Tara?
Thank you. Tara Kopp with McClatchy. Captain, I have a question. So are you establishing any plans in case you end up having coronavirus on the ship? As you know, some of these patients are asymptomatic. You may be treating someone that didn't even know, doesn't have a fever. What would you do in that case? And then if you could tell us what units are manning the ship, what bases they come from?
So I'll take the first part of that question. I'll let Admiral Weber take the second part. Essentially, if we identify someone as COVID-19 positive, our intention would be to transfer their care back off of the ship. And over to you, Admiral Weber.
Yeah, as far as sourcing the ship with the medical professionals, they are coming from 8 military treatment facilities in my region, in the western region of the United States. We're not pulling any from overseas. We certainly can get the specifics for you, but the 8 in my region, which is the bulk of the 800 to 1,000, Naval Medical Center San Diego, Naval Hospital Camp Pendleton, Naval Hospital 29 Palms, Naval Hospital Bremerton, our clinic in Oak Harbor. That's where the bulk of them are coming from. There are a few personnel coming in small, very small, single-digit amounts from other facilities.
Okay, we'll go back to the phone. Paul, Washington Post.
Hi there. I just wanted to, two quick questions. How many beds does the hospital have, does the ship have, and how many crew members will be on the ship in total? And then secondly, I just wanted to follow up on Tara's question about screening. Are you testing, has everyone who will be manning the ship already been tested? Obviously we've seen a lot about how coronavirus, is sort of a petri dish on these ships. So, if you have a crew member who's perhaps asymptomatic when they get on the ship, how can you be sure of that? And is there any sort of rapid testing for patients as they get transferred? Can you tell us a little bit more about the screening process?
Let me take the beds and crew members part of your question first. On the medical treatment facility side, we'll top out at 1128. There are some additional military assets on board, the mission commander and his staff, as well as force protection folks, public affairs team, and some other supporting elements. It's a total of 1,000 beds in our facility. We're planning on staffing 9 of our 12 operating rooms as well, if needed. And then in terms of screening for folks, everyone who's coming on the ship, military, civilian, is being screened. If we did wind up with somebody that we either diagnosed with COVID-19 or thought was highly likely based on their medical assessment, we would be looking to send them off the ship and do appropriate preventative measures for any contacts they had.
Okay, Megan?
So following up on this question about asymptomatic carriers, is there going to be any sort of infection control measures that you guys are going to implement on Mercy that you wouldn't normally have in a trauma center, keeping in mind that there could be asymptomatic people coming on?
So we're going to completely comply with CDC guidance on infection control. Essentially we practice infection control every day in our normal hospital operating environment. We're going to do the exact same thing on the Mercy, and also applying additional disinfection measures throughout the ship, not just the medical treatment facility portion, as directed by the Navy.
Okay, and then back to the phone. Carla from Voice of America.
Hey, this is Carla from VOA. Thank you so much for doing this to keep us all informed. Captain, I just need a clarification on when the Mercy is going to be leaving today. What time is it set to depart? And then also, I know you can't talk about the Comfort specifically, but how long does it take to undergo maintenance, and what steps can you take to speed up the maintenance process as we're trying to guess when the Comfort is going to be ready?
So for your second question about the maintenance on the Comfort, I'm going to have to defer you to the public affairs folks at NAV North. With respect to our departure today, we're leaving at 2 o'clock local time here in San Diego.
Okay. Glenn?
Just whoever is on the line, please, that is typing away, could you please mute your phone, please? Mute your line unless you're being asked a question.
Yes, there's a lot of interference. Thank you. Thank you. Okay, Mike Glenn, Washington Times.
Yes, sir. This is for the ship's master. If you could also tell your name again, because I forgot it. The Comfort and the Mercy are both well-known ships. Have done a lot of good work. They're also some of the oldest ships in the Navy. And I know the Comfort is still undergoing maintenance. How is the Mercy operationally shipworthy? Is it ready to go for this kind of mission? And I realize it's got a short steaming mission, just from San Diego up to LA. But how's it doing mechanically, Captain?
Hi, my name is Captain Jonathan Olmsted, O-L-M-S-T-E-D. And to answer your question, Mercy is ready to go. She's ship shape. My job as the ship's master is to keep the ship ready to go on a 5-day activation notice at all times. I like to rely on the ship's motto, steaming to assist, and that's what we're prepared to do.
Okay, thank you.
Okay. And Courtney?
Hey, it's Courtney Kuby from NBC News. I just want to make sure I understand a couple of things that you've laid out so far. First off, on the amount of time that the Mercy could be underway, I understand that you are there at the behest of FEMA and whatnot, but how long are you telling the individuals on the ship they will be assigned to the ship for this mission? And can you also, I'm not 100% clear on I think it was 1,126 or 28 individuals, I think it is. Those are the people who are on the ship right now. I'm sorry, if you could just explain that a little bit more, and then I have one other. Thanks.
Captain Dan Cobian, Mission Commander. Regarding to how long the mission is planned for, we are prepared to stay underway until the need is complete and until it doesn't make sense anymore, or as directed. We will remain pierside as necessary.
And the number of people?
And for the second part of your question, this is Captain Rotruk, the MTF commanding officer. So the 1,128 total, 1,128 total, is what we expect to be once we arrive in LA and pick up some more folks there pierside. So we're not departing with that many. That's our final number.
Okay. And then can you also say, and I'm sorry, I don't know who this would be best for, but are you preparing for to deploy and be in Los Angeles for a number of days, weeks, whatever it is, and then are you prepared to go on to other locations if the need be?
Yes, Captain Cobian again. We are prepared to stay as long as necessary in Los Angeles and prepared to move on to whatever port or destination that FEMA directs or is required by higher headquarters.
Okay, we're going to go back and take a couple more from the phone. Mary from CBS.
I wonder if you, thank you gentlemen for doing this. It's Mary Walsh from CBS News. Did you choose your staff by balancing against civilian needs in the medical towns that they're from? We were told that many of the medical professionals come from the reserves. So there's been constant discussion of that. So are you bringing in reserves, or are they all active duty?
Yeah, this is Rear Admiral Tim Weber. As the staff are coming from the military hospitals, allow me to take that one. So all are active duty on board, except the 58 or so reservists that I talked about earlier. They're coming from military treatment facilities where they are already previously identified to deploy on the Mercy. That way they know the Mercy, appropriate training is done for a hospital ship. Certainly there is discussion about the use of the reserves at a higher echelon, but for this mission, right now it is those active duty, with the exception of those 58 reservists.
Okay, and we'll go to Caitlin from Stars and Stripes.
Hi, I just wanted to know if what kind of help you'll be providing to patients on the ship. Is there going to be like OB/GYN care or any other types of long-term services, or is it just trauma care that you'll be providing?
So we are prepared to offer a broad range of medical and surgical services, both as needed by the local hospitals that we're supporting. We are not going to be doing obstetric care or pediatric care on the ship.
Sorry, it's Paul from Washington Post. Can I just ask a quick follow-up question? I wanted, you had said that there will be screening, but the 1128, they're not all getting tested for coronavirus to make sure that they're negative before they're on the ship, right?
That's correct. They are being screened, but not tested unless there's an indication based on the CDC guidelines to test them.
And what does the screening mean?
Questionnaire initially, then follow-on temperature testing if appropriate, and then assessment by a medical provider.
Thanks.
Okay, let's go to Louis from ABC.
Hi, thanks for doing this call. Just I have a logistical question and then a treatment question. My logistical question is, if the Mercy is departing this afternoon, and I think at the top the admiral said the ship will arrive within the week, why is it safe to assume that it's going to arrive tomorrow? I mean, the distance between San Diego and LA is just 120 miles.
This is Captain Olmsted, ship's master. Upon departure from San Diego, the ship has a number of required operations, tests, certifications that must be conducted at sea underway prior to any arrival.
So that will limit, that will slow down the potential arrival by, a couple of days. Is that what you're saying?
That is correct.
Captain
Okay, and my treatment question.
Do we know when it's going to arrive?
This is Captain Robichuk. If I can add to Captain Olmsted's response, the time that we're underway and he's doing operations specific to the ship itself, that is the opportunity for the medical treatment facility staff to train as a team. So I'm very blessed to have a group of individually highly skilled medical and other professionals, because there are many non-medical specialties that support the hospital. But what we really need is time to train as a team so that we can be effective and provide safe and high-quality patient care when we arrive.
And then my treatment question is, or the screening question is, will you have enough tests aboard to test for COVID if you have a patient who later develops symptoms if they come on board being asymptomatic? Will you have enough, or will you have to require those tests come from somewhere else?
So we have an initial stock of those tests, and as we see what the demand signal is, we'll use our normal resupply chain to get more.
Okay, we'll just take a couple more questions. Tara in the room?
Thank you. I had just a quick follow-up. Will the Mercy actually be docking in LA, or will it be in Long Beach where there's other facilities? And then will you also be carrying a blood bank? As you know, a lot of these communities have talked about blood donation shortages.
Captain Olmsted, ship's master. We are currently planning to dock within the port of Los Angeles.
And this is Captain Robichuk. We currently have a fully capable blood bank on board the ship.
But how many units will you be carrying, or you will not be carrying units?
We will be carrying blood products with us, and we're going to ramp up that amount based on the demand signal that we see once we arrive.
Okay, and we'll go to Amanda from CNBC on the phone.
Thanks so much. I'm wondering if you can and I understand that the size and the scope of this mission is going to change depending on the demand that you see, but there has to be some sort of baseline operating costs that you could provide us, given the fact that these were two lumbering oil tankers converted into hospital ships. I just have an understanding that these are very expensive vessels to operate. Thanks.
Sorry, ma'am, can you clarify the question for us? Is it operating cost or transition? Can you just clarify?
Yeah, just how expensive would it be to have these vessels up and running, taking in patients? I mean, just understanding what generators, if you have ICU beds that you're going to be using. I mean, it's just a massive hospital ship, and the costs seem exorbitant. But I'm just wondering if you could provide any clarity on the operational cost of this vessel. And I understand it's going to be it's going to be port side, but if you have any type of number you can give us some sort of sense on.
Yeah, this is Admiral Weber. So the projected budget is not yet determined, and I would refer any follow-on to that question over to the Military Sealift Command PAO.
Okay. Thank you. That's all we have time for today. Gentlemen, do you have any closing remarks that you'd like to give?
Yeah, this is Admiral Weber. I have a couple of things I'd like to pass along. First is I want to make sure that as someone in the healthcare business, there are actions we all can take, right? And you can't tell this enough times. Social distancing is the best way to prevent the illness. Make sure everyone online and listening and writing are washing their hands for 20 seconds. or more. Avoid touching your face and clean and disinfect those high-touch areas. You've heard this multiple times, whether you're in a military hospital on shore or sea or anywhere else, those are critical. Now, my final comment on the mission ahead. The men and women of the USNS Mercy, as all DoD staff, serve a higher calling to protect and defend this country. With COVID-19, Navy medicine, as in any time our country calls, is delivering medical power to assist our communities in time of need. I could not be prouder of the men and women aboard the Mercy. All Americans should be as well.
And this is Captain Rotruck. Our Mercy team is ready to deploy and support FEMA and local agencies in their relief efforts against the COVID-19 pandemic. I have an amazing team, and we are truly honored to answer the nation's call to protect the health of the American people.
Lieutenant Genualdi, that's all we have from our end.
All right, thank you all.